start the program off, I just want to introduce myself. My name is Stuart Schlossman. I'm president and founder of MS Views and News, and it's a grassroots, nonprofit patient advocacy organization. We offer free educational programs and resources to the multiple sclerosis community. Our intent is to help people living with multiple sclerosis to better manage living with the disease and have an improved quality of life. Today, I'll be interviewing Dr. Tornatore and Dr. Chaudhry. The questions and comments will be about multiple sclerosis. More specifically, we'll learn more about new therapeutics through communication with healthcare providers. Additionally, we will explore increased awareness of new treatment options, potential treatments on the horizon, and the understanding more about clinical trials. We're excited to learn more today, so allow me to introduce you to both doctors. Dr. Tornatore, can you tell us a little bit about yourself and your background?
Sure thing. Thank you, first of all, Stuart, for having me on. I really appreciate the opportunity to talk about what's going on in MS and how excited we are about this. So I went to Cornell as an undergraduate. I was very fortunate at the time to be a neuroscience major. This was in the late 70s, and so this was a new major, and so I was able to do that, and then went to med school at Georgetown, where I continued my interest in the neurosciences and did some research as a medical student. I then did a residency in neurology at Georgetown, and then following that, I went to the NIH and did a fellowship in neurovirology and molecular neuroimmunology. So for 6 years, I worked at the bench looking at the interaction of the immune system and viruses in the nervous system and how it could lead to inflammatory disorders of the brain. We were looking at HIV, but also it crossed over into MS and other immunologic disorders. And then in 1996, I came back to the mothership at Georgetown, and I've been there for almost 30 years. I've risen through the ranks, and I'm currently the chair of neurology at Georgetown, both at the medical center and at our academic partner, Georgetown University. I'm also the regional director for all of neurology for MedStar. MedStar is the 8th largest hospital system in the country. We take care of 1 in 4 people in the Mid-Atlantic. So big healthcare system. Our MS center, we have over 3,000 patients with MS. We're involved in over 30 clinical trials for MS. And we currently have, I think it's 9 MS providers taking care of patients. And so thank you again for having me on. Looking forward to the dialogue.
Excellent. Thank you very much. And Dr. Chaudhry, how about yourself? Can you tell us a little bit about your background?
Absolutely. Stuart, first of all, thank you for having us. Thank you for giving us this platform on MS via Views and News. As you mentioned, my name is Burhan Chaudhry. I, like Dr. Tornatore, am a board-certified neurologist as well. I actually got interested in neurology. My younger sister, was diagnosed with MS when I was in med school. So that's how I got interested in neurology. I did my residency at the University of Mississippi, followed by fellowships in neurocritical care and then neuroimmunology at the Cleveland Clinic. And my neuroimmunology fellowship was focused on multiple sclerosis. Currently, I'm an employee at Bristol-Myers Squibb, where I am in early clinical development, focused on clinical trials in MS. Specifically, these days, I'm focused on cell therapy in MS. And like you, I live with MS as well, and so consider myself a MS warrior like you and countless others.
Thank you very much. Now, I'm going to be asking you both questions, and I seem to be leaning toward Dr. Tornatore first all the time, and then I'll come back and ask you the same questions, okay? So, doctors, what are the 3 most important questions about new therapeutics you feel patients should be asking their MS neurologists? Dr. Tornatore, you first, please.
Sure. So, I agree. There are 3 questions that patients should come to their appointments and ask their providers about. Number 1 is, what have we learned about MS from prior therapeutics? This is important, and I'll go into more details on this. The second one is, how does that inform us about the future therapies for MS? So what have we learned from prior therapies? how do you think that's going to help us understand future therapies? And probably most important thing is, how do these new therapeutics in the future help address the neurodegenerative part of MS? That is, what we're now recognizing is the CNS smoldering inflammation. And those are the three questions. I can give you more details as to why I think those are important. So for instance, what have we learned about MS from prior therapeutics? What we've learned is that MS really has two pieces to it. One is there is active inflammation. So that active inflammation can cause an attack, right? Somebody one day wakes up and they have visual loss, and you're like, what happened? Well, they had active inflammation of the optic nerve that popped up, and why these attacks occur is still a bit of a mystery. But we know that that active inflammation can be brought down very effectively with a lot of the therapeutics we've used over the past 30 years. So we can decrease attacks from MS very, very significantly with, especially with our newer therapeutics. But we've also learned that there is a second part of MS, which is less so the active inflammation that causes attacks. That part is what we call more of a smoldering inflammation, where there's kind of low-grade inflammation that's in the brain, and it seems to be there all the time. Even if we can stop attacks, which seem to come from the blood, there's still some smoldering inflammation in the brain that continues. And people say, well, yeah, I've been taking these drugs and I haven't had an attack in a while, but, I'm slowly getting worse. I've noticed, my walking is maybe not as good as it was 2 or 3 years ago. Or, they notice that their bladder function isn't as good. And so clearly there is an ongoing component to this disease process that's more than just the active inflammation. And we now recognize that this is what we call smoldering inflammation in the brain, where there's some just very low-grade inflammation that our current therapeutics are not quite getting at. So what does that tell us about future therapeutics? Well, we have to hit both, right? We have to be able to knock down the active inflammation and knock down attacks. But we also now have to start to target that inflammation that's inside the brain, the smoldering inflammation, because if we don't, then we're going to have patients that are not having attacks, but that they're progressing on us. And this progression is sometimes referred to, it's not the most nice term, but we call it the neurodegenerative component of MS, where people, the brain is degenerating, if you will, because of this ongoing inflammation that's happening. And so as we design our new therapeutics, we're going to have to hit not only active inflammation, but we're also going to have to target that smoldering inflammation in the brain. So I think those are, the questions that people should really address their providers as they come in and see them, on an every 6-month or annual basis.
Thank you for your answers. I feel that MS patients should be asking those kinds of, I feel that they should be asking questions similar to, how are the new therapeutics different than the older ones? And will these new therapeutics be addressing progression in MS? And what is the safety profile of these new therapeutics? Can you answer those, please?
Absolutely, Stuart. So I fully agree with the Dr. Tornatore. He laid it out very clearly as to what should be on top of mind for these MS patients. Now, you mentioned, how are these future therapeutics going to be different than our previous ones that are already available? Now, that's a very important question that patients should ask their neurologist. And one of the main things we've seen is that, as we have learned more about the disease itself, and we've gotten better at trying to answer these specific scientific questions, now we have within our arsenal are these small molecules that can cross over into the central nervous system. So meaning they can get into the brain and spinal cord, which our previous molecules are just not able to, or if they're able to, it's in very, very small concentration. So with these new therapeutics, there is this potential for them to get into the CNS and have that effect on progression that Dr. Tornatore was talking about. Now, with that being said, how quickly will these therapeutics be available to patients? That is something that that patients should also discuss with their neurologist. Now, they're not on the horizon right away, but there are a lot of clinical trials that are going on, so they can definitely or should ask their neurologist about these clinical trials, and if it would be something that would be helpful to them, and that it's something that they would qualify for. And then you brought up safety, very, very important question. Now, we all want to make sure that whatever we are giving our patients is safe for them. First mantra is do no harm. Mm-hmm. So it's very important that that our patients really grill a neurologist about if there is a new medication that they're going to be transitioned to, or if they are talking about a clinical trial, what does the safety profile look like? Will it affect their other organs? Will it affect their labs? Will it affect their ability to, a child bearing a potential for our female MS patients? So all of these are very, very important, because as we are aware that, this is a disease of the young. So these issues are very, very important. Another really important issue is interactions with other medications. Our MS patients can be taking quite a few medications at the same time. Again, it's very important that whatever medication you're about to go on, will it be interfering with our other medications as well.
Well, that's great to hear. So I would like to briefly ask you about smoldering MS. I know Dr. Tornatore just said something about it, but I want you to please discuss what this means in as best of layman terminology as you can.
Absolutely. So Dr. Tornatore did a really, really good job of really going deep into it. But if you really want to simplify it, Stuart, so MS affects the brain and the spinal cord, which is, which we call the central nervous system. Now, I'm sure a lot of our patients have heard about, inflammation. There is inflammation happening within the CNS. Now, that inflammation is pretty much, generalized. So it's all over the brain and the spinal cord, really depending on where our patients are having, symptoms and where they can see these lesions on their MRIs. Now, smoldering inflammation that we're talking about, it's much more, it's in a specific part of the brain. So it's like a regional inflammation as opposed to a generalized inflammation. So there's different parts of the brain. You have gray matter, you have a lot of nuclei that are very, very important for specific functions. So smoldering inflammation is really localized within a specific part of the brain. And there are a few parts of the brain where we feel like if you're having smoldering inflammation, you are more likely to have progression within your disease journey. And if we can try to really slow down that localized inflammation, we'll be able to slow down progression as well. So I hope that that was more clear to our audiences, that we are looking at the larger picture where inflammation happens across the entire CNS. Smoldering inflammation is within certain pockets of the brain or the spinal cord.
Thank you. I want to thank you both for answering that specific question of this, because you both gave slightly different answers, but I think it encompasses everything for better understanding of everybody. So next, another crucial question. What potential new treatment options are being researched, and how are these treatments different from current therapies? Can you delve more, please, into cellular therapy? Dr. Tornatore, I'd like to start with you first.
Sure. There really are two big things that are happening in MS these days. One are what we call the BTK inhibitors, Bruton tyrosine kinase inhibitors. These are, as Dr. Chaudhry said, small molecules. They are small molecules that are already being used in oncology as well as some other disease states. And what the BTKs do is they hit the part of the immune system called the B cells, and in so doing, bring down inflammation, because the B cells are the part of the immune system that drive some of the inflammation in MS. And some of these also cross into the brain and bring down inflammation, that smoldering inflammation, we think, or we like to believe that that's going to be the case. And so these BTK inhibitors are in clinical trials right now. The data for them has been mixed. There was one that the phase 3 trial did not work out, the endpoints were not met. And then there are others that are either in progress or the data is being released that show some promising results, but still a long ways before we can say with any certainty that they will block not only inflammation in the brain, but also that smoldering inflammation. And so it's still a little bit of an unknown how well those are going to work in that regard.
Specifically, though, can you tell us what cellular therapy in general and CAR-T cell therapy are specifically?
So this is the other area which is incredibly interesting. So Dr. Chaudhry is very fortunate to be working in the space with BMS. And cell therapy is the idea that rather than having small molecules or pills that you would take to treat your MS, that in fact you would be using cells to target the inflammation of MS. And more specifically, you would use your own cells that would be reprogrammed and re-engineered to attack the very specific areas that we think not only cause MS, but also may get at the smoldering inflammation in the brain as well. So this is an incredibly interesting area. And the term specifically that's used in cellular therapies, there is one in particular called Car-T therapy, and it's an abbreviation for chimeric antigen receptor, T cell receptor. But basically what happens is the basic idea is that you take your own cells, they're re-engineered, they're given back to you, and then those re-engineered cells now have the properties to target the bad players in MS, if you will. And this has been used in oncology very successfully. So people have certain cancers. We know their white blood cells are either trying to get rid of the cancer or the cancer itself is in the white blood cells. So what happens is the patients, and I'll go into more detail later on, the patient's blood cells are harvested, they're re-engineered, and then they're given back to the patient. And those cells now have special honing capability to attack those areas that are problematic, and they can be engineered specifically for that area. So we're very excited about CAR-T therapy because this would target not only the inflammation of MS in the bloodstream, but these cells do cross into the brain because they're your own cells and could target that smoldering inflammation in the brain. Really very exciting.
Okay, thank you. What are the potential risks and side effects of these requirements for patients who may be considering or being considered for the cell therapy and clinical trial?
Yeah, so this is a big deal to have this done. And there are probably 4 steps for this to happen. So first of all, the first step is you would go to an outpatient setting and you would have white blood cells taken out of your bloodstream. So you would be sitting in a chair, and this is called leukapheresis, where it's basically like a dialysis machine. You would just be sitting there, and the machine would then filter your blood for your own white blood cells. And then that usually takes about 5 or 6 hours. And then once that's done, you leave, you don't stay there. But now those white blood cells have been harvested. And then the second stage is those white blood cells are actually sent to a lab that will re-engineer them. And it's absolutely fascinating. This work is has really revolutionized how we treat cancers and we think immunologic diseases. So the cells are re-engineered, and they're still your own cells. And so that usually takes about 3 or 4 weeks because they have to be engineered and then they have to be expanded. So the number of them have to be increased. So you have a bigger army, if you will. And then the next phase is the patient would say, okay, now I'm going to get those cells back. But in so doing, prior to getting those cells, patients receive what's called conditioning chemotherapy. So they would receive chemotherapy for a couple of days, essentially to make room for these new cells that are coming in. And then the patient receives, they go to the hospital, at least as it's currently set up, the patient would go to the hospital and then these cells would be infused. And the infusion doesn't take very long at all, maybe an hour or two. And then they're there. And then for about a week, the patient is observed in the hospital because these cells are now going to start to hit their target. And their target is going to be white blood cells in their blood, white blood cells in their bone marrow, in their lymph nodes, and it's going to be trafficking into the nervous system also. During that time, this war, if you will, that's going on between the CAR-T cells and the target cells in MS may lead to some inflammation. And this patients may experience different things. These are called cytokine release syndrome. And so patients may feel feverish. Their blood pressure may fluctuate. And so there may be a host of things that can happen. And also, as the white blood cells are trafficking into the nervous system, patients may experience problems in that way. They may feel that cognitively they're not as good because there is, if you will, these CAR-T cells are trying to bring down the inflammation in the brain. And so for about a week, we observe the patient to make sure that this inflammation is happening, number one, but also that it can be well maintained. Sometimes the inflammation can be quite significant, in which case patients might need medication to help keep that at bay, if you will. Then the patient leaves the hospital, and then these CAR-T cells still are circulating and doing their job, and we think they remain so for at least 3 to 6 months. And so there is a period of time where we continue to observe patients and follow up with them, make sure that they're doing okay, and that the cells are doing what we hope they are doing. And so it is an involved process, but the amazing thing is this is really so different than any of our previous medications. It really gets into the deep inhibition of those cells that we think cause MS that our other therapeutics are not able to get. And these cells, they're there, right? They remain with you for at least 3 or 6 months. So they will continue to do what they were designed to do. And not only that, once they are in the person, they will expand normally, which is fascinating, right? And so that army, if you will continue to grow and continue to look for its targets. And then they have a limited lifespan. And then after 3 or 6 months, we think they will probably start to die off on their own, just as the normal process of cells turning over.
Okay, great. Thank you for that answer. I'm going to continue with you for a few moments. I'm going to ask you another question. How do people, the patients, find out about these types of treatments and clinical trials? And can you discuss how one can realistically take part in a clinical trial, how you can fit the clinical trial participation into your life, given the requirements for like Car-T Cellular Therapy?
Yeah, so great questions. So for a patient, the first place they can look for new trials for MS is if they go to clinicaltrials.gov. That's a government site that lists all of the clinical trials that are currently under review by the government. And so that's a great place. You go to clinicaltrials.gov, type in multiple sclerosis, and all the clinical trials for MS will pop up. And then you can kind of click through each of them and see to see if you're eligible. So for instance, these are called the inclusion criteria. So some of them will say we're looking for people with relapsing MS. Others will say we're looking for people who have primary progressive MS. Some of them have age restrictions, right? They'll say that we're looking for patients 18 to 55, or we're looking for patients 18 to 65. Some of them may be looking only for a specific gender or race if someone identifies in a certain way. And so there are inclusion and exclusion. And then what you've previously been treated with may also allow you to be included in the study, or it may exclude you from the study if depending on what you've previously been treated with. The other place to find out about clinical trials are the National MS Society website. And again, they keep a nice running tally of current studies that are ongoing. And the sites, this is really important, right? Because you can say, oh, this looks like a great trial for me. However, it may not be offered, where you live because the clinical trial site may be somewhere else in the country. That doesn't mean you can't be part of it. It might require you to travel. And then the third way is when you see your provider is to ask them and say, are you doing any clinical trials in MS? Am I eligible for them? Or do you know of any MS clinical trials in the current region that we're in that I might be able to be part of, or that I could call the investigator and see if I'm eligible? And many times, for instance, when we're involved in a clinical trial, we have a website. Patients can go and they may not be able to interpret, I don't know which is the right study for me, but we have research coordinators they can call and they can say, hey, look, I'm interested in a study. This is my background. This is who I am. Am I potentially eligible for any of these studies? And the coordinator might say, actually, maybe so. Let me forward your name on to the investigator, and then they will talk to you at more length and see if you're eligible. So those are really three ways: clinicaltrials.gov, the National MS Society, and then asking your provider.
Thank you very much. And I'm going to add in two other places where people can go to. And one, of course, is the bmsclinicaltrials.com. And then, of course, I have to tell you about the MS Views and News website, that we have the resources page on there as well. And that could give you all that information as well. Dr. Chaudhry, so going further with you, I would like to ask you, patients should be able to ask their neurologist about ongoing clinical trials. Can you tell us, please, more about this?
Absolutely. So as Dr. Tornatore really clearly laid out all of these different avenues that are, available to patients to really find out about trials on their own. But absolutely, your neurologist is a really good resource as well. So you should always be asking your neurologist about clinical trials. Hey, we had talked about, even though we have medications that are really good at, bringing down the relapses, lesions on MRI, but, patients still keep on having issues and we still see some progression. So if you're not happy with the way your MS is, not being managed, but how it's, evolving over time, definitely ask your neurologist about these clinical trials. They will absolutely be able to guide you in the appropriate manner. Now, as was mentioned by Dr. Tornatore, is that that your neurologist might not be offering that trial to you. That's a distinct possibility. So then you can always ask your neurologist to get you in touch with a site that is nearby, and to see that if you can be a part of this clinical trial and to get more information about the trial as well. Specifically, if we're talking about these CAR-T trials, as Dr. Tornatore laid out very clearly, that it is it is a time commitment from patients, and it is an intensive process. So that referring site could also really dive deep into patients about all of that information as well. And now once that happens, let's say you spoke to your neurologist, they told you about this specific study, they referred you to a site where that study was going on, you can set up a visit. Now that visit is going to serve a purpose where you will find out, that the type of MS you have, is that eligible for this study? Are you the right age? Have you had the diagnosis for the appropriate amount of time? How much disability have you accrued over these years? And then, these studies also have exclusion criteria around, specific medications, or lab work. Lab work is very important, and then they'll have to make sure that like certain lab parameters are met. Now, if you fly through that visit you have, which can also be called as the quote-unquote screening visit, that is when you are able to be enrolled in the study. So that's, just in a nutshell how this process looks like for these patients. But absolutely, reach out to your neurologist and also look to all of these resources that you and Dr. Tornatore mentioned. I will also like to point out the MS community, we really take care of each other, right? Yes. So you should also, if you're a part of, some kind of forum, some kind of small groups, always ask your fellow MS warriors, hey, do you know about any clinical trials that are going on? I feel like that has also been a pretty good source for our patients.
Okay, thank you very much. Something that was not touched on is how much time is actually needed for a person to be in CAR-T therapy? How much time is needed for them from the time that they're accepted to getting involved, and how much time do they need to be away from home?
Right, so that's, Stuart, is a very good question. Again, we talked about how this specific study is very different and unique to other MS studies. So the closest thing we have a comparison to is, stem cell transplant studies, where patients, we give them stem cell transplants. This is, similar, but also very different as well. And Dr. Tornatore did a fantastic job of really laying down all of the different stages. Now, to specifically answer your question, once the patient gets leukapheresis done, the process where we collect their blood to really work on their T cells, Dr. Tornatore mentioned that is done outpatient, and you do not require any stay over there. Now, once that is done, a few weeks are needed for the Car-T cells to be manufactured. Now, that can take anywhere from 4 to 6 weeks. And that, the patient is not doing anything, they are living their lives. Once those Car-Ts are manufactured, they are sent back to the site where the patient will get eventually treated with them. Then Dr. Tornatore mentioned that, these patients have to be given chemotherapy. That is also done as an outpatient as well. Now, once that is done, that's when you get admitted to the hospital and you get infused with the Car-T. Now, that is day one of your hospitalization. You have to be typically hospitalized for 2 weeks. That's just because purely for safety reasons, we are still in early days. So again, the whole mantra is do no harm. So, and the reasons were again laid down really well by Dr. Tornatore as to why that's done. So it's 2 weeks. Then once the patient is discharged, we ask that the patient stay within a certain radius to your treating facility. Because again, as Dr. Tornatore mentioned, these cells are still circulating in your system. So those are 2 more weeks that we really ask patients to live close by. So it's really a month's time commitment, which is no easy feat. These patients have lives, families, priorities. So it is time intensive for sure. But the hope is, given the unique nature of these Car-T cells, this will hopefully be just a one-time treatment. But still, as these trials go on, we will really learn as to how long the patient really requires. But that's where we are right now.
Dr. Chaudhry, patients have a way of having a lot of questions that they really don't get a chance to ask when they learn about the clinical trials, when they hear about it at programs that they go to that one company or another are providing. And one of the questions that we always hear from the patients is, who's paying their expenses for transportation to get to the trial site, for their hotel, if that's where you're housing them, for their food, and what if they have an animal that needs to be cared for? Can you tell us a little bit about this?
It's true. That's a very good question, a very important question, because these people have lives. We're asking them to give a major investment of time. 1 month is no mean feat. Now, sponsors, and when I say sponsors, are basically the companies that are running these studies. Sponsors cover the entire cost of hospitalizations, transport related to the study, follow-up visits related to the study, all of the imaging, lab work, everything that is pertaining to the study is covered by the sponsors. And you could easily have a situation where we talked about a patient goes to his or her neurologist and they ask about a clinical trial, they find out about CAR-T, they're really excited, they want to be a part of it, but their neurologist's practice is not a part of that study. They will have to be referred somewhere else. So that cost will be covered by the sponsor as well. Whatever travel costs incurred in relation to the study will all be covered by the sponsor. And and certain sponsors try to make it as easy for the patients as well, given their unique situations at home. So that is so that there is one less thing for patients to worry about, because cost is a huge part of this.
Great, thank you so much for that. And Dr. Tornatore, so something else to ask you is regarding the follow-up care. How long is that actual follow-up care, and where do the patients go for this care after they're released from the month that they were in the actual study? So if a person actually lives in Oshkosh, Wisconsin, and they went to do a trial study in Los Angeles, where are they going to go for that additional follow-up care once they're back in their hometown?
So all of the care would be back at where the original study is being done. So before somebody enrolls in a clinical trial, it's very important that they realize that they're committing to at least 2 years in the study where they will need to go back to the primary area where the study is being done. And that's a big deal. And if somebody can't commit to that, then they really shouldn't be in a clinical trial. But there are many people who understand the potential value of a clinical trial and are willing to travel, back and forth, across the country to be part of a study that's as important as this one. So, and those first 2 years are very critical. That's when patients are followed to see, is this actually working? Is their MRI actually quieting down? Have they had any attacks? And all of these things. And then studies generally are 2 years. That gives us enough insight into how well things work. And then we are obligated actually for the next 15 years to monitor these patients and see how things are going. That's just part of all studies where we have to maintain our records and things like that. But given that CAR-T is such an interesting area, I think all of us recognize that we will gladly follow these patients, because I think they're going to teach us an enormous amount. And so it's not one and done, although it's quite interesting because they only get treated once. And then really everything after that is observational. No more, treatments or anything like that, we hope. And so we are super interested in following these patients over extended periods of time to see what happens with them. So there's a lot of oversight and a lot of care that's given to patients in these studies.
Sure, and the patients would greatly want that as well. So I think it's fantastic that that's the course. So doctors, I want to thank you both for your insightful answers. This information will be incredibly valuable for the patients as they navigate their treatment options and discuss this with their neurologist. So again, thank you for being here today. I want to thank you both for all the time that you gave, and now you can go back to your day.
Thank you, Stuart.
Thank you.
Thank you very much, Stuart. Appreciate it.
Bye-bye.